Thank you for being here today, and you can begin your testimony.
Thank you. Good afternoon. My name is Darcy Walker Krause, and I'm the Executive Director at Uplift Center for Grieving Children. I want to start by thanking Councilmember Johnson for inviting me here today to provide this testimony. Thank you as well to all the council members and presenters here today who are putting a light on this critically important issue. I want to start by providing some introductory information on the work we do at Uplift Center for Grieving Children as it pertains to what we're discussing here today. Then, as requested, I will discuss what our clinical team is seeing regarding youth mental health, both as related to the COVID pandemic as well as the gun violence epidemic. I will share some of the concerns that our youth are highlighting and some key issues that we should be paying attention to. Uplift Center for Grieving Children helps children grieving a death to heal and grow through their grief while strengthening families, communities, and professionals' understanding of how best to respond to their needs. Our vision is simple and direct. No child should have to grieve alone. To effectuate this mission and vision, Uplift provides a variety of services to support Philadelphia children, families, and the professionals who work with them. One of the first services that we offer, and it's the core of what we do, are our free grief groups. Uplift provides free grief groups to children who've lost a significant person in their life. These groups provide support and coping skills for grieving youth and are provided in several formats. First, we have our family services format, where both the child and caregiver can attend concurrent peer support grief groups, which are facilitated by our clinicians. Families can attend as long as they need. We also offer shorter-term grief groups in schools and community organizations. These run between 5 to 8 weeks. All grief groups are run by our master's level trained clinicians and are curriculum-based. Our curricula include a homicide-specific loss curriculum, Spanish language, ambiguous loss, and LGBTQIA+ curriculum. Second service that we offer is our post-crisis response. In addition to these grief groups, we work closely with the network of neighbors, the school district of Philadelphia's prevention and intervention team, and other partners when there's a loss affecting youth in school communities. Specifically, our clinicians provide legacy groups, which are memorial groups for youth who have lost friends or teachers, usually to homicide. As many of you know, as I know I've spoken about this before, when the schools closed in March 2020, we partnered with the school district to create the Philly Hope Line. It's 1-833-PHL-HOPE, a helpline that provides support for children, caregivers, and families who are experiencing mental health issues such as stress, anxiety, and isolation, losses such as death losses or ambiguous loss, and other crises. Uplift has utilized the Hope Line to provide critical support to youth and families in Philadelphia. The Hope Line has also been used in coordination with the school district's Office of Prevention and Intervention, as well as the network of neighbors, in coordinating post-crisis response and offering a warm line where affected youth and families can call to receive support. We're also partnered with CHOP and the University Assisted Community Schools, which is part of Penn's Netter Center, in the Growing Resilience in Teens project. As part of this project, our clinicians are providing grief groups and ambiguous loss groups at CHOP's Carabot Center and in schools in West Philadelphia. Ambiguous loss groups differ from those groups for children grieving a death, and that ambiguous loss is the emotional is the emotional and or physical loss of someone or something important in the child's life. Examples include a child whose parent is incarcerated or a child who is placed in the foster care system and is no longer able to access their prior parents or guardians. A recent example that we all experienced, that many of us experienced ambiguous losses during the COVID pandemic. We provide trainings. Our team goes out. We can't get to everyone, and so they provide trainings to professionals such as teachers, counselors, social workers, therapists, so that they can better understand grief and trauma and how to support children. To give you an idea of the scope of this work, this year we will serve more than 2,500 children and parents and caregivers directly in our groups and services. This includes that by the end of the year, we will have run 53 family grief groups for children, youth, and caregivers with additional summer programming planned. In addition to these groups, we actually do detailed intakes with the families and provide case management while the families are enrolled. In schools, we've provided grief groups to 58 schools to date, and with another 45 schools receiving support this spring. This year, like last year, we got off to a slow start given that some of the groups were virtual. But to give context, in 2019, we ran approximately 200 school grief groups. So that is a program that serves a lot of youth in our city. In our GRIT project with CHOP and the Netter Center, we provided 45 groups since the inception of that project in 2020. We've provided post-crisis support and legacy groups to nearly 115 youth and caregivers since the fall. While we've been responding to gun violence for years, the surge in deaths, particularly those of youth, has been dramatic. Each program year, we train over 2,000 professionals And since this last year, we trained 3,316 professionals in grief and trauma. Finally, since October, the Hope Line has now been seeing double the callers that we had been seeing previously. So with that, the services and support on that are clearly increasing as well. In April 2021, I testified here about how the work that we do at Uplift has given us a front row seat to the intersection of the crises plaguing our city: gun violence, homicide, COVID-19, the fall of the pandemic, and racial trauma. I shared about the confluence of factors that had put our children and families into a state of crisis. In December of 2021, the Surgeon General released an advisory on protecting youth mental health, noting an increase in mental health issues prior to the pandemic, which we at Uplift had certainly seen with increases in suicide. The Surgeon General noted the unprecedented challenges facing youth with the pandemic, including the high numbers of deaths and the distancing from supportive loved ones. The advisory was noticeably silent on homicide, the increase of gun violence occurring nationwide, and how these factors could affect youth mental health. The report did note, however, that youth mental health is influenced by neighborhood safety, and that youth mental health is at higher risk when a youth has experienced trauma, experiences more adverse childhood experiences such as community violence, and when youth live in an urban environment. Additionally, the groups advisory noted a higher risk for mental health issues are well represented in our city population: racial and ethnic minority youth and low-income youth. What we at Uplift are seeing indicates that many Philadelphia youth are at high risk for mental health challenges as defined by this advisory. In speaking with the associate directors of our clinical team, they asked me to share these numbers and this information. As related to causes of death, 60% of youth signed up for our school grief groups have lost a loved one to homicide. 40% of youth in our family services groups have lost a loved one to homicide. I can tell you, I've been at Uplift now for 9 years, that back probably 4 maybe 5 years ago, these numbers were closer to 20 and 30%, 20% in family services, 30% in school groups. Although nearly 40% of the youth report their loved one dying of illness, only 3% report death from COVID. This underrepresentation of COVID deaths is surprising to our team, and we believe that it may be influenced by a stigma associated with dying of COVID. While death of a father is the #1 reason youth seek our services, peer death, typically to homicide, is the #2 reason that youth seek Uplift services. In our school groups, our youth are reporting that they're fearful and reticent to be outside in their neighborhoods. They share that their parents and caregivers often won't allow them to be out and about. While community gun violence has long been a problem, youth report that there's a shift now. One of my clinicians actually specifically, she said this is kind of the words of the kids, that there used to kind of be the rule that you didn't shoot in certain areas, you didn't or at certain times, and that now they feel like they could be shot anywhere at any time, and they're scared anytime they're out walking to or from school. Even for youth not in a grief group due to a homicide loss, many youth are affected by the homicide losses and are talking about it in group. There are going to be long-lasting effects as well related to the pandemic. Our youth are still feeling the reverberations of the pandemic. They're reporting record levels of isolation and loneliness during the shutdown, and many are still grieving the fact that there are things they couldn't do during COVID that related to losing loved ones, such as attending funerals or memorials of loved ones who died during the pandemic. Research has shown that not being involved in that mourning and closure process actually can prolong and complicate the grief process. On top of all these death losses and community violence, youth are also processing difficult, ambiguous losses, including having incarcerated loved ones and youth in the foster care system grieving the loss of caregivers that they don't have access to. Return to schools has been positive generally and overall for all the youth that we work with. But like everywhere, the schools are short-staffed, meaning the counselors are often spread thin, and this makes them less available to the students. And as one of my clinicians said, the kids feel it. That said, the youth are relieved to be back in the school buildings and for these services to be back in person as well. Looking at our data against the advisory, it's clear that Philadelphia's youth are at the nexus of this crisis and certainly at risk for negative mental health outcomes. However, as a result of the pandemic and budgetary reasons, many schools are under-resourced to respond with best practices despite efforts. Research shows that support and socio-emotional protective factors, as well as psychosocial services, can aid in processing difficult emotions and build resilience. As referenced in the advisory, it'd be my advice to have schools and government agencies like the Network of Neighbors continue to partner with community-based youth and family serving agencies as they do already. That said, I know that many of these agencies, like our own, are at maximum capacity absent additional capital investments. While there's been some distribution of funding around violence prevention, additional investment is likely necessary. This mental health crisis is not going to abate tomorrow or even in the next year. Here at our staff, we talk about this being something that we'll be seeing for the next 10 years. We need to be equipped to handle these reverberations down the line. Thank you again for your time, for giving Uplift Center for Grieving Children and the children and families we serve a voice here today.